Alright guys, how are you doing today? So just another little thing that we do at Ocean View Dental Care that can be super helpful to our patients that maybe a lot of people don't know about. So this is Jackie, this is our wonderful front desk and assistant. And so Jackie suffers from getting cold sores, or actually the medical diagnosis for that is actually a herpatic lesion. So 65 to 90% of adults actually have herpes, and a lot of things can vary in how they're expressed. So stress can cause them, a lot of exposure to sunlight can cause them, even dental trauma. So if you bump your lip, sometimes that will cause a response and will start to express that virus again. And that's when we see those cold sores or those blisters that start to form. Now, Jackie knows that one is coming on because a lot of times when we have a cold sore coming on, there's a tingling, right? So yeah, so she started to feel a tingle yesterday, and the biggest thing with treating any type of herpetic lesion, whether we're going to use a medication or if we're going to use a laser, is getting to it sooner rather than later so that we can decrease the amount of time that the lesion is actually active. So for her, what we're going to do is we're going to do some laser treatment. We're going to do 3 rounds of 30 seconds, and what that does is that attacks that area, kind of zaps the virus, and also stimulates the immune system in that area to start fighting it, and decreases the amount of time that the blister is actually going to form. So we have a shorter duration, usually untreated, usually goes for about 2 weeks. And then for this, we should probably shorten her treatment up to just about 3 days. So she's going to start to see some resolve pretty quickly, along with the fact that a lot of her symptoms, if she's got pain in that area, it's really going to stop that. And she should really start to feel some results immediately after this treatment, okay? Okay, so Jackie was able to identify what area she kind of felt that little kind of tingling feeling, and it's about right here in her lip. So we're going to do about a 30-second treatment. Go ahead and open. We all got our safety glasses on, and all we're going to do is just keep the suction about right here, and she's going to feel some warm sensations as we do this, but we're basically just kind of treating that area and stimulating that immune system and killing that virus. Alright, so that's kind of the end of our first treatment. Jackie, how did that feel?
It was warm.
So warm. Any pain at all?
Not really.
No. Okay, so great. So we're going to do that 2 more times for her. I'm going to give her about a minute for that tissue to rest. Then we're going to hit it twice more for 30 seconds. And that's about the only treatment that she's going to need. And we'll follow up with her tomorrow to see how things are healing. Hi, so this is Jackie. We're just doing a follow-up on her today. We did laser treatment. She had a herpetic lesion that was coming on her lip that she was starting to feel. So we zapped it literally the first day that you felt it, right? So she could feel it. There was a small little bump there. We did 3 rounds of our laser treatment. Only takes about 30 seconds each. And then you can see it was right down in this area and absolutely nothing. And how did everything feel?
Everything went good. Normally, I get a really big bump, and I normally get a really bad tingling sensation. After the laser treatment, about 20 minutes later, the tingling stopped, and I woke up the next morning. There was no